Hello, I'm Dr. Mashhadian. I'm a cosmetic surgeon here in Rodeo Drive, Beverly Hills, and I have the pleasure of taking care of Lynn today. Lynn has been experiencing some Bell's palsy on the right side of her face for the past few years, and today she's given me the privilege of taking care of her today. We're going to do some mask camouflaging so that she obtains some symmetry. Previously have done some Botox or Dysport in the upper forehead, and she has been experiencing some improvement. Lynn, would you be kind enough to give us a little bit of frowning? Okay. She has some muscle activity in this area. Christy, are you able to capture that? Yes. We're going to be able to, we're going to do some Dysport in that area. You could also use Botox in that area to relax this muscle so that these both areas are more symmetrical. Her laugh line appears to be deeper compared to this side. We're going to fill that, and we're also going to use a cannula technique, which is needleless. There's no sharp tips. This way there's no chance of bruising, and also it's much more comfortable for her. These areas have previously been wiped with alcohol, and she also has received some topical anesthesia. Lynn, I'm going to go ahead and give you the Dysport in this area first. This is a cold compress. If you'd be kind enough to just hold this for me. Thank you so much. You're going to feel about 3 to 4 pinches in that area. When you feel the area being cool, you let me know.
That feels pretty good.
You ready?
Mm-hmm.
I'm going to bring you. Go ahead and give me a frown like the way you were. Fantastic. All right, you're going to feel a quick little pinch in the middle and 2 pinches on the side. 1 and 2. Excellent. Give me another frown. Excellent. We're targeting these muscles specifically. Gonna get. She has a little bit of activity right over here. We're going to relax that as well. Raise your eyebrows. Good. Excellent. 1 more pinch here. Excellent. So that's going to take care of that. Obviously, the medicine doesn't work instantaneously, so we're going to need about a few days before that works. And we're going to concentrate in this area. I'm going to bring your chair up. Lynn, was that comfortable? Was that okay?
Painless.
I'm going to have you bring your chin up a little bit this way for me. Thank you. Or you are going to feel a quick little pinch right over here. Take a nice deep breath in and out. Excellent. Quick little pinch. As I was telling you, then also you can take a look at it yourself if you're interested. This is actually not a needle. This is a blunt tip. So we made 1 little small skin piercing, and we're going to find that. If you can bring your chin a little bit higher up for me. Thank you so much. All right. You may feel some discomfort as I'm entering the skin. It's going to feel a little bit funny. Are you okay there?
Mm-hmm.
Does that hurt you, sweetie?
Mm-mm, not at all.
Okay, Lynn. The beauty of fillers is that you get instantaneous gratification. You see the result immediately. So that works very well. Alright, you're getting some nice improvement. Does that bother you at all?
No.
Okay, so the numbing cream is working very well. The Juvederm XC has numbing medication in it as well. So as the injections are continued, they get more comfortable as the numbing medicine starts working. I also feel you have some scar tissue under here as I'm giving you this material. I think you've had some injections probably before, and they cause some scarring in the area.
Yes, usually.
All right. So you can see that the area has drastically improved. I'm doing serial layers, cross-hatching, building an architecture of hyaluronic in that area. And basically right before your eye. You can see an improvement here. All right. And I'm going to go ahead and hand you the mirror. You can approve the result.
Wow. Wow. Yeah.
Is that improved?
Definitely. It's actually even more symmetrical.
We're trying to get a symmetry as best as we can. It's difficult to obtain that, but the improvement is there. That looks good. We do have a few drops left, and if that's okay with you, I want to put that right in this area. Would that be okay with you, Lynn?
Yes, please.
But I want to tweak this area a little bit more for you before we go to the other side, because this was our primary concern. As the material settles, it gets better. So in about a couple of days, you'll see a better improvement. I'm going to go ahead and sit you back. Okay, as we were talking about Lynn over here, she has a little bit of indentation in this area that is difficult to capture on a film, but when she sits forward, you're able to see that. So we're going to fill that for him using the cannula technique. So I'm using a small needle to make an entry into the skin first. You okay there, Lynn?
Yes.
I'm going to have you turn a little bit this way. If you can bring your chin up, I would appreciate it. Thank you so much. I could feel the indentation here. I'm going to go ahead and place the cannula under the skin. You're going to feel some pushing and pressure. Are you okay, Lynn?
Yes, very comfortable.
Okay. I'm so sorry. I know this area may be a little uncomfortable. As the filler is placed in, it has numbing medication in it again, and you will start feeling more comfort. You okay there?
Yes.
Excellent. So the material is implanted in this area, and the chance of bruising is almost zero. So we're going to do a little bit of massage in that area to make sure the material is placed in the appropriate manner. Now we also have done some injection here. We're going to make sure that it's not lumpy, it's nice and smooth. Right, I'm going to go ahead and sit you up. This way you can take a look and confirm, make sure you're happy with everything.
Okay.
Again, to summarize what we just accomplished for Lynn, she has given me the privilege of taking care of her. We did some Dysport to take care of the frown lines. We did some fillers to get rid of that indentation. And we added some filler here in the laugh line, the nasolabial fold area, to make that a little bit more symmetrical. And Lynn, can you tell me, was that comfortable? Did you feel any discomfort?
None, not whatsoever. It actually tickled a little bit.
Yeah.
But the one thing that's shocking me the most is there was tension on this side of the face. I feel a difference. It feels more relaxed, and
excellent.
I'm looking at it. It looks great.
Yes, and
It's
as
like
it settles, it gets a little bit improved, and obviously the Dysport takes a few days for it to start working. Again, thank you, Lynn, for letting me take care of you again.
Thank
Our
you.
office here in Rodeo Drive. If you have any questions, please don't hesitate to call me and speak to Christy or Sayan, my fantastic patient coordinators and office managers. Our phone number is 310-652-4500, and you also can look at some before and after photos in our website, rodeosurgicalart.com. Hey, Lynn, again, thank you so much for letting me take care of you.
Thank you. I appreciate everything.
Thank you.